Hi, I'm Dr. Suzette Glasner, clinical psychologist and associate professor of psychiatry at UCLA. Today, we're going to talk about what is so risky about teen alcohol and drug use and how we can protect or insulate our youth against early initiation of substance use, which we understand from research to have a pretty sizable impact on future alcohol or substance use. So I want to start by talking a little bit about brain development at this age, because brain development has everything to do with the risks associated with drinking and drug use among teenagers. So thinking about the pace at which our brains develop. So for women, brain development is considered complete somewhere between the ages of 21 and 23. For men, it takes a little bit longer, where brain development is considered complete between the ages of 23 and 25. When people use substances prior to the point in time when their brain development is complete, it can really have powerful effects on this essentially undeveloped brain. So in essence, drug and alcohol use can disrupt that development that is ongoing, and the functions that are developing at that point in time between the ages of, say, 13 and 21 are really important functions during adulthood that we all use in our everyday lives and are very dependent on to be healthy and stable. So let's talk about which parts of the brain I'm referring to. The last part of the brain to develop is known as the prefrontal cortex. And the prefrontal cortex is really important, what we refer to as sort of higher order functions. So that is logical reasoning, making healthy decisions, using good judgment, and importantly, controlling one's impulses. Some of the earlier parts of the brain to develop are those structures that are known to be part of what we refer to as the limbic system. The limbic system is heavily involved in regulating and processing our emotions. And so in a teen, one psychologist described teen brain development in what I think is a very compelling way, especially when thinking about where drug and alcohol use could fit in or could be disruptive. So because of this well-developed limbic system that's processing emotions, it's as though the teen has been given an accelerator for a car, but the prefrontal cortex would be the brakes. And it's not that they don't have brakes, but the brakes have not been fully developed. So when you apply this to a situation where you think about a teen coming under peer pressure or running with very high emotions, and you have this really well-developed accelerator, and you don't have as strong or well-developed of a brake, that accelerator in their brain is going to tell them to go. And that message of go can lead to poor impulse control, can lead to not the healthiest decisions, and can lead them ultimately to self-destructive behaviors such as substance use. And then once they start using drugs and alcohol, then that is disrupting the very process of development of that prefrontal cortex, that higher order thinking that is so critical to them in the future, declining offers of alcohol or drugs, or protecting themselves from getting into trouble with alcohol or drugs, or developing problematic alcohol use. So for all of those reasons, the age at which we're at the greatest risk of developing problematic substance use that could progress into addiction is adolescence, those adolescent years. And in fact, studies show that 85% of individuals who meet criteria at some point in their lifetime for a diagnosable substance use disorder do so during those adolescent years. So a related point in research is like, okay, how much protection do you buy yourself from not using drugs or alcohol during those adolescent years? And there have been studies that looked at exactly that question, which was between the ages of 13 and 21. If you can delay initiating substance use and disrupting that brain development that is so crucial to making healthy decisions, how much does that buy you year after year? And the findings from those studies have shown that you reduce your risk of developing lifelong addiction addiction or problems with alcohol and substance use by 4 to 5% with every year that you delay initiation of substance use between the ages of 13 and 21. So even if you start using substances or you start drinking before it's legal to drink at age 18, simply delaying until 18 rather than starting at the age of 13 or 14 has protected your young person from the risk of developing addiction by as much as 25%, which is pretty profound. And in alignment with some of those findings, we do see that the greatest risk of going on to develop addiction later in life is found among individuals who start using substances around 14 or earlier. Which of our young kids are at risk of using or experimenting with substances at a young age in the first place? And there have been a lot of studies to help us understand what those risk factors are. So I'm just going to give you some of what we have learned about that list of risk factors. So first of all, we know that early experiences of trauma place a young person at risk. That's actually the same for adults, by the way. Second, we know that kids who are not frequently monitored by their parents or a caregiver are also at heightened risk. It just creates a situation where they have more means and access and opportunities to engage in some of these behaviors if there's very little monitoring of what they're doing, especially at those young ages. Another risk factor is having very minimal involvement in school or not feeling particularly connected to or tied to school. Another risk factor is being exposed to other people who are using substances or who are struggling with addiction. So in particular, being around or exposed to parents and or siblings who are drinking or using substances is considered to be another predictive factor or risk factor for initiation of substance use at an early age. So now I want to talk about the protective factors, or what we call buffers, that reduce the risk of a young person getting involved in drinking or substance use. So studies have identified a number of those, and many of them are kind of the opposite of what I described as far as risk factors, right? So frequent parental monitoring, knowing where your kids are and knowing what they're up to can go a long way towards preventing their engagement in some of these risky and unhealthy behaviors. Another protective factor is what is known as like a strong bond to school. So feeling a close connection to school, the people who are at school, the activities or clubs or other aspects of either academics or extracurriculars at school that create that feeling of being very bonded to school is known as a protective factor. Another protective factor is having very clearly defined family rules for behavior. And tied to that is the provision of some kinds of positive rewards for positive behaviors. In general, what the research literature shows around rewards and punishments is that rewards tend to be really powerful ways of shaping positive behaviors. Punishment, if you find that you're punishing your kids all the time, then those punishments can sort of have a reduced impact. It's almost like your kids can become used to the punishments and they're just not as effective. But certainly finding those positive behaviors to reinforce and having very clear rules, boundaries, and guidelines around what's expected of a young person are all protective factors against early initiation of substance use. And then finally, developing or having positive and what we would consider to be healthy coping skills, including what we refer to as drug refusal skills. So having sort of a framework in mind for your young person to access in a difficult moment when they don't have prefrontal cortex fully developed and it is difficult to control impulses and to resist peer pressure, if that is counteracted by having sort of a good sense of how to have that conversation with somebody who's tempting you with an offer of alcohol or drugs, what you're going to say, it's all sort of pre-planned and ready. Those are something that we refer to as drug refusal skills. And there's a lot of good literature out there that I'm happy to share with you all about how to help a young person to develop that skill set, not only for drug refusal, but also positive coping behaviors factors and healthy coping behaviors to deal with other negative experiences that might contribute to stress and might make it more tempting to experiment with substance use to relieve some of that stress. So I want to highlight one particular study because I gave you such a long list. Okay, here are the things that place a person at risk. Some of them are in your control and some of them are outside of your control. Whether your child or teen has been exposed to traumatic events is something that is usually out of our control, whereas whether parents are monitoring a child's whereabouts is more in our control. So I give you a pretty varied list of those buffers or protective factors. So I want to just bring out from research, what are some of the most important ones? They're all important to some extent, and every bit can help. Every bit of buffer that you can incorporate into your child or young person's life can help, and every bit of risk factor that you can eliminate can also be helpful. But I want to just leverage some of our research to understand what might be some of the more important factors to focus on. And there was one study that followed kids from the ages of 10 all the way to 21 and evaluated some of those risk factors that we're talking about to see which ones were the most predictive of kids developing an alcohol use disorder. And what that study found was that the greatest risk factors included having a lot of opportunities to engage in socializing with what were referred to as antisocial peers. So antisocial meaning having antisocial characteristics that clinically, when we talk about antisocial, we're talking about kids who may engage in a lot of lying or substance use or theft or other behaviors that are getting them into disciplinary trouble in school. So spending a lot of time around peers who are engaged in those behaviors was one strong predictor. And the other strong predictor was a lack of parental monitoring. So again, highlighting how important it is to have a really good sense of not only where your teen is, but also who they are spending time with and what those people are like. And then the most protective buffer was a strong bond to school. So this was the most protective factor starting as early as age 10, protecting kids from going on to developing a substance use disorder or an addiction was having a strong bond to school. So what does that tell us about what you can do as parents or caregivers of a preteen or a teenager to reduce that likelihood that they're going to get involved in drinking and drug use as their teenage years progress, which is a tempting thing to do given the widespread prevalence of substance use at those ages today. So here are a couple of things that you can do. First of all, the theme should probably be apparent that parental monitoring is super important. And I think parents tend to feel ambivalent about the extent of monitoring they want to engage in because they don't want to be perceived as overly controlling or annoying. So I'm going to share some resources in my latest newsletter from the National Institutes of Health on how you can establish some of those healthy boundaries, healthy guidelines, and monitor your kids' whereabouts, have knowledge of who they're hanging out with and who their friends are in a way that also preserves their independence and their ability to make choices for themselves. I make it sound so easy. It's not, but definitely a topic worth reading about in the parenting space as far as how you maintain really good understanding of what your kids are up to, but at the same time, let them be their own person and not create a rift in the relationship as a result of that monitoring, which I think is a lot of what parents fear when it comes to implementing some of these practices. Another one is helping equip your kids with these healthy coping skills. So there are a lot of books out there on ways of coping with stress for teens. There are a variety of techniques that teens and young people can use to deal with stress, anxiety, and mood changes, which are not uncommon during those years. So cognitive behavioral therapy approaches can be really helpful to get them in tune with how they're thinking and how their thoughts impact their moods and behaviors. Mindfulness-based practices can be really great for stress reduction and anxiety management. Also for sort of slowing down and being thoughtful and mindful about the choices that they make. So again, in my newsletter, which you can find on my website at drglasner.com, you can find some resources that will be really helpful potentially for your teen to learn some of those healthy coping strategies. And finally, this very robust and well-established link between a strong bond to school and delayed initiation of substance use is something that's really worth thinking about about how can you help your child create a strong bond to school. It's not something that may come naturally to all kids, but if you can help them channel their energy into something that they're passionate about that is linked with school and form those positive associations with school and school related activities, whether those are extracurricular sports or whether they're other interest groups or whether they're on an academic track of being part of competitions and other extracurricular kind of opportunities, creating that strong bond can really give them something healthy to focus on and to develop and to care about enough that it protects them from developing unhealthy behaviors. And finally, all of these ideas should be anchored to the understanding that the development of addiction in a young person or an adult is influenced by many things. And just because your teen or preteen has risk factors for developing addiction does not mean that addiction is inevitable. And likewise, just because you do some of these very helpful things to create these buffers, there's not a guarantee that they're not going to develop an unhealthy relationship with substance use, because we understand substance use disorders to be the result of the interaction between many complex factors that include genetics, the environment where a person is raised, the psychological, individual characteristics of a person and their tendencies, and a whole host of other factors that I have discussed briefly on this podcast. So for more information, please visit my website at drglasner.com. Thank you for being here today, and I look forward to seeing you next time.